This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
Supposed to
help us or
Medical Dilemma.
Hi, I'm Sonny Del Rosario and you are watching Medical Dilemma. Alexander Smith once said, "Memory is a man's real possession. In nothing else is he rich, in nothing else is he poor." It is therefore understandable why losing one's memory is extremely painful not only for the sufferer, but also for the sufferer's loved ones. In this episode, we talk about Alzheimer's disease, a condition characterized by severe memory and cognitive ability loss, termed by many as the forgetful malady. With me for the first segment is Dr. Michelle Anlacan, a neurologist subspecializing in dementia, head of the Center for Memory of the Philippine General Hospital, and member of the Dementia Council of the Philippine Neurological Association. Welcome to the show, Dr. Anlacan.
Hi, good day, Sunny.
Doctora, for the sake of our viewers, maybe we should first tackle questions that are basic to understanding Alzheimer's disease. Maybe you can first explain what in general is dementia and what in particular is Alzheimer's disease.
Dementia is what happens when you have severe memory loss and decrease in cognition to the point that your daily activities are already impaired, meaning there are things that you can no longer do because of this memory problem. So those patients who have those problems have dementia. But the most common cause is Alzheimer's disease. We say Alzheimer's disease when we have no direct cause for their memory loss. For example, there is no trauma, there is no accident, there is no stroke, there are no blood clots in the brain that explain what is happening.
Could you describe some actions that sufferers of Alzheimer's disease normally show or exhibit?
Well, in the initial stages, they just really forget.
They just really forget things.
So initially, there are short lapses in memory, and then it becomes more frequent, and then it already interferes with daily activities. Meaning, for example, if you're an accountant, it's very difficult for you to calculate. Or if you are a teacher, it's difficult for you to prepare the lesson plan and actually teach. So, and then later on, it's not just the memory that is impaired. Language can also be impaired. They cannot find the right words to say. They cannot express what they need and want. So it's a progressive disease. It goes on and on. Initially, it's only memory that is impaired, but later on, all the other aspects also become deteriorated. So that's language, planning, sequencing events, calculation, even social activities may be impaired.
I see. Now, at what age usually would you detect dementia or Alzheimer's?
It is most commonly found in people above 60 years old.
Above 60
So
years old.
they are really the senior citizens.
Is it not possible to have an early onset of Alzheimer's?
Well, I have seen early onset Alzheimer's disease, but they are a rarity. Usually, it's really above 60 years old.
I see. Now, I'm curious. You mentioned that there is no cause for Alzheimer's, but what does medical research say so far regarding, how the disease develops?
Well, there is an abnormal accumulation of the proteins inside the brain. So it accumulates inside the nerve cell and outside of it. So the whole brain becomes clogged with abnormal protein, and that is why the brain cannot function. So progressively, neurons or the nerve cells, they progressively die, and it leads to shrinking of the brain, more importantly in the areas of memory.
Okay. Now, once a sufferer is diagnosed to have Alzheimer's disease, then what should the sufferer or maybe the loved ones of the sufferer do to manage the condition?
Well, the first thing they have to do is to go for checkup because medications work better in the early stages. So the first thing to do is for a checkup. They need to be diagnosed, so proper workup should be done. They are just basic lab tests and a CT scan or an MRI. It's very basic. You're just trying to find out other reversible causes of this memory problem. And in the absence of those, then we give the diagnosis. Most of the time, even during the time of workup, I already start the medication, just so that the patient will have enough time to take the medication, and it's given early on, so they have the best prognosis.
You mentioned that there are some reversible causes. Okay?
Reversible.
I suppose these refer to like the causes coming from accidents.
Because Alzheimer's disease is progressive and
Yes.
irreversible, but there are some causes of memory problems that are actually reversible. Very common that I see in the memory clinics are hypothyroidism. They've had thyroid surgery before, tapos they don't have any other source of thyroid hormone, and then they forget their doctor checkups later on. That's why they are deficient in the hormone. So that's one. The others are caused by strokes. That is one of the most common ones that I see in the Philippines. They have a stroke and then they have a memory problem.
Okay, in the case of Alzheimer's, it's not reversible.
Yes,
But
and
you can retard the progress.
yes. Usually the scan in Alzheimer's disease is either normal in the early stage or there are already shrinking parts, especially in the areas for memory.
I see. Now, what about when a sufferer reaches, the advanced stages of Alzheimer's? How are such patients taken care of now?
Well, in the advancing stage, it is more difficult for everyone, for the patient, for the family, and also for the caregiver, because this is also the time that they present with many behavioral problems. They could be very apathetic or they can be aggressive. So, very varied
So
talaga yung
extreme.
presentation. Yes, it's very
Extreme
extreme.
behavior.
It's very extreme. Some are very apathetic to the point that they hardly move. They can just watch TV all day and not comprehend anything. Or they can actually be very agitated, very aggressive, they act like children, and I want this, I want that, give it to me. So, yeah, it's very, very variable. But inevitably, all of them in the progressive stages, they require supervision and care. So initially, you just need reminders like
Okay.
take a bath,
Yes.
change your clothes, groom yourself.
simple instructions.
Yes. But later on, they might need help in washing themselves and doing basic activities, even eating. They might need help
okay.
with that.
Is Alzheimer's something that can be inherited?
Well, a small percentage is heritable in a sense that every generation of the family manifests with it. But majority still happens sporadically. It just happens.
It just happens.
But of course, we have identified some risk factors, and if you don't want to develop it, you might want to avoid the risk factors, so which are hypertension, uncontrolled diabetes, heart
The
disease.
usual.
Yes, the
Diabetes.
usual things that cause a stroke may also give you Alzheimer's disease.
Okay,
So,
I see.
kung iiwas ka dun sa risk factors na yon, then you avoid two things, stroke and Alzheimer's disease. So it's a win-win situation for you.
Okay, thank you so much for the information, Dr. Anlacan. It's now time to take a commercial break. We'll be right back after a few words from our sponsors. That's the first segment.
products were designed to be used in industrial and medical economy.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?